Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles. Today, I would love to share with you a beautiful result on a 50-year-old woman who had a cluster of concerns that is not typical of our patients, and she got a really dramatic improvement. Let's check it out. So this 50-year-old woman has a history of acne scarring, even a little bit of acne currently, as you can see from the pictures. Acne scarring is tough to get rid of. The one problem is it tends to look more and more prominent as skin elasticity diminishes with age. She has very thick, heavy, sebaceous skin, which is more difficult to work with than the typical skin. She has hooding over her eyes, and if you look at her nose, it's quite a bulbous, broad nose. It's something that really bothered her. If you look at her neck and the jowls and the marionette lines, they're all quite significant for a 50-year-old patient. She was interested in improving all of these, so I suggested for her the following combination of procedures. First and foremost, my Traceless face and neck lift operation. It's one of my signature facial rejuvenation procedures where I get dramatic improvements for a patient with results that are so natural, it's difficult even for other surgeons to tell if they've had work done. I also performed upper eyelid surgery on her. That allowed much more light to enter her eyes. She also desired a rhinoplasty, and that was a procedure that involved multiple components, including making the overall tip of her nose less bulbous, making it more defined. But her nostril rims were also much broader and thicker than she desired. So we did what are called alar wedge excisions, which means removing a wedge of the nostrils from each side to bring in the width of her nose and make the nostrils overall more aesthetically ideal. I'm elated with the results that we got here. As you can see, even though I didn't do anything for the acne scars in particular, they are much less noticeable after surgery because we have tightened the skin and really smoothed out that skin. The eyelids let far more light into her eyes so that they sparkle in the sunlight and gives her a more beautiful appearance, more engaging look when she's in conversation, made her overall younger and more beautiful appearing. Lastly, the nose. It's kind of a tricky nose because when you have thick sebaceous skin, it's like having a very thick tablecloth and mat on your beautiful antique table. You can't really tell what's underneath there. So we had to remove some of that fat on the tip of her nose, rework the cartilages, rework those nostrils in a way that we were able to accomplish our goals and do it all with a very natural appearing result. I think that the ultimate result is that she has more ideal aesthetics, she appears much younger, and most importantly, she feels better about herself and her appearance. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles, discussing pan-facial rejuvenation on a 50-year-old woman with a face and neck lift, rhinoplasty, and eyelid surgery.